Our topic for today is we are going to unpack and understand the impact of COVID-19 on the early childhood development in Namibia. But as customary, today is Sunday morning. I would like to welcome on the podium Pastor Teddy to actually lead our session for today with a prayer. Pastor Teddy, the opportunity is yours.
Good morning and thank you. If I may begin by reading a passage from the Gospel of John, chapter 20, verses 19 to 31. On the evening of that day, the first day of the week, the doors being shut where the disciples were for fear of the Jews, Jesus came and stood among them and said to them, "Peace be with you." When he had said this, he showed them his hands and his side. Then the disciples were glad when they saw the Lord Jesus. And Jesus said to them again, "Peace be with you. As the Father has sent me, even so I send you." And when he had said this, he breathed on them and said to them, "Receive the Holy Spirit. If you forgive the sins of any, they are forgiven. If you retain the sins of any, they are retained." Now Thomas, one of the 12, called the twin, was not with them when Jesus came. So the other disciples told him, "We have seen the Lord." But he said to them, "Unless I see in his hands the print of the nails, and place my finger in the mark of the nails, and place my hand in his side, I will not believe." 8 days later, his disciples were again in the house, and Thomas was with them. The doors were shut, but Jesus came and stood among them and said, "Peace be with you." Then he said to Thomas, "Put your finger here and see my hands, and put your hand and place it in my side. Do not be faithless, but believing." Thomas answered him, "My Lord and my God." Jesus said to him, "You have believed because you have seen me. Blessed are those who have not seen and yet believe." Now Jesus did many other signs in the presence of the disciples, which are not written in this book, but these are written that you may believe that Jesus is the Christ, the Son of God, and that believing you may have life in his name. Peace be with you. Let us share that greeting of Jesus with our brothers, our sisters, and all our family members. Jesus is alive. Jesus is with us. We will overcome this pandemic. Jesus shows Thomas his wounds today. Like Jesus, we are all wounded, and Jesus meets us in our woundedness. We bring the message of Jesus to all who are working so hard to combat this virus. Our president, our ministers, our doctors, nurses, pharmacists, the cleaners and cooks in our hospitals, our ambulance drivers, those who work as security guards, our administrative staff, our policemen and women, all our media practitioners, radio, TV, newspapers, all those who collect our garbage and those who work in our grocery stores, all who live in Namibia, who are sick, those who care for the sick, and those who are well. Welcome the greeting of Jesus today. He says it 3 times, "Peace be with you." I had the privilege of meeting via Zoom a group of people from many countries in the world on Thursday. They work with a program called The Healing of Memories, and they spoke about the effect of the coronavirus in countries as far apart as Sri Lanka, Myanmar, Canada, United States, Europe. And one of them, a bishop, said, we need to offer the healing of memories to all who are on the front line. And we will be willing to do that in Namibia once this coronavirus is over. There is no place in our world for tribalism, for xenophobia, or for narrow nationalism. We are, as Pope Francis has told us in his teaching on the environment, Laudato Si', we are interdependent. This world is our common home. As President Geingob has said on many occasions, we all belong in the Namibian house. We need each other. And we follow, and while we do follow the directive to regularly wash our hands to avoid the virus, let us not wash our hands of our responsibility to each other, particularly the poor who feel the impact of the lockdown the most and who will be affected by the virus the most. When we speak of Jesus, our risen Lord, we do not have a high priest who is unable to sympathize with our weaknesses, but we have one who in every respect has been tested as we are, yet without sin. Let us therefore approach the throne of grace with boldness, so that we may receive mercy and find grace to help in times of need. I invite you to join with me in approaching this throne of grace as we pray a prayer. It is a prayer that I got from Archbishop Liborius Ndumbukuti Nashenda, Archbishop of Windhoek. And I will be saying this prayer with a group of people in Holy Redeemer Parish as I say Mass, assisted by Deacon Matu Hoffman. And I will also be saying with the Poor Clare Sisters in Brackwater. In both cases, there will be less than 10 people present, but our Mass will be recorded by Matisse Samaria, and she will send it by Facebook to our parishioners and to any who wish to join with us in prayer. So I've given the prayer to some members of the panel, if you would like to join me in saying this prayer together. Almighty and merciful Father, who shows your love to all creation, we come before you asking for a quick control of the coronavirus currently ravaging our world. Hear graciously the prayers we make for those affected by the virus in various parts of the world. Grant healing to the sick, eternal life to the dead, and consolation to the bereaved families. We pray that an effective medicine to combat the sickness be speedily found. We pray for the relevant governments and health authorities that they take appropriate steps for the good of the people. Look upon us in your mercy and forgive us our failings. We ask this through our Lord Jesus. Amen.
Thank you very much, Pastor Teddy, for such a prayer. Additionally to this, may I now invite the Deputy Minister of Health to come and give us an update on the health status on COVID-19 in Namibia. Dr. Esther Monyangwe would like to give you an opportunity on the podium.
Thank you very much. Good morning, everyone. Good Good morning to our panelists. Good morning. Oh, my father is leaving. The update, because that has become now a culture, even if we have to repeat what we said the previous day, because it's not every minute that every Namibian is sitting in front of the television or is listening to the radio. That is why it is necessary also to repeat, even if we have said that already. Hence, the update report remains the same as yesterday. We still have those 16 confirmed cases, of which 6 have recovered, as we also heard yesterday from my minister. And up to now, we don't have new confirmed cases. So the recovered cases, they are case number 3, 5, 6, 14, 15, and 16. And we are informed by our case management team that all the cases are clinically doing very well. So the total who have been tested, both by NIP and PathCare, amounts to 524, and we have 127 currently in quarantine facilities. So that is a very short update. I know that the media houses, there are a lot of questions around the quarantine and isolation facilities. I want to mention that the ministry will issue a media release in that regard. So no questions on that, please, for now. Let's understand each other. Okay, so maybe just a final word, with your permission, to our health practitioners who are, we know, and if one is watching videos from other parts of the world, and you listen to what the healthcare workers are sharing their experiences, it's very terrible. It's terrible. One cannot imagine what they are going through, putting their own lives at risk, but it's a profession that they have taken to help others. And as I'm always saying, I just want to make them know that we have them in our prayers. We think about them in this difficult time. We know that everyone is anxious, people are terrified, and imagine our health workers who are dealing on a daily basis with these cases. So God bless you all. Thank you very much.
Thank you very much, Dr. Esther Monyangwe, for the health updates. There you have it. It's 524 tested cases, 127 currently on quarantine, and 6 recovered COVID-19 cases that we have in our country right now. So we are moving into our discussion. As I said, today we are speaking about the impact of COVID-19 on the early childhood development in Namibia. But before we move into our discussion, I would like to actually inform the public that should one have a question related to or want to pose a question to our panelists here today at the Communication Center, our open line who are calling in will be open, and the number will be displayed on the left bottom corner of our screen there. So just get that number, and should you have a question, you are welcome to ask any question when our line opens for call in. Ms. Mbombo, first, maybe we should start with you. The first question that we need to look at is, how has COVID-19 really impacted the aspect of early childhood development in Namibia?
Thank you very much, Mr. Ngula, for giving us the opportunity to share with you and with the nation as to how COVID-19 is impacting early childhood development. Again, my name is Martha Mbombo, the Deputy Executive Director in the Ministry of Gender Equality, Poverty Eradication and Social Welfare. As in many areas of life, COVID-19 brought immense challenges but it also, to some extent, it brought some opportunities. But let me first put into the context of our discussion as to what is early childhood development, or as it is well known, ECD. ECD is understood to be the period in a child's life since the child's birth until the time when he or she reaches the school-going age. Now, our ministry take care of the age group 0 to 4, and the Ministry of Basic Education, Arts and Culture takes over, 0 to 4 going 5, and the Ministry of Basic Education take over, 5 going 6 as a pre-primary, and then 6 going 7 up to 8 as a primary education. Now, this is an extremely important period in a child's development, and for building a strong foundation for lifelong learning and also for the general well-being. Now, we are all aware that of the state of emergency COVID-19 regulation by His Excellency, our President of the Republic of Namibia, which among others calls for schools and education institutions to remain closed, but to employ other alternative forms of learning, as long as it does not involve physical presence of learners or students in the institution. Now, in compliance with the regulation, our ministry, we have also issued a press release calling for ECD centers, whether you call it them creche or daycare or kindergartens or preschools to some extent, to also remain closed, and the children should remain at home to prevent the spread of coronavirus and to protect the children. And educarers, we the teachers of kindergarten, we call them educarers, and also to protect the parents that they are bringing children to the centers. Now, just to give an indication of the likely number of children that are involved, those that we are asking to remain at home. According to the Intercensal Demographic Survey, a total population of 388,202 children between the age of 0 to 5 attended ECD in 2016. So 24% are males and 25% are females. Now, this number have since increased according to our latest ECD survey, which is to be published soon. So the point here is that the number of children, this number of children that we are talking about, 388,000 plus, plus their parents, plus their teachers, we are saying they should remain home, because the number is just too huge. It's probably very difficult to keep these children in a center. I know that we receive numerous queries and suggestions by ECD owners. They say, no, we have a big yard, we have a big classroom, we can keep 10 children in the class and we can take care of them. We just want to appeal to our communities. Children are children. Children want to play, and we don't want to expose them to that risk of they will definitely play and run around and run and jump to the other one. So the best thing we can do, dear parents, stay at home. Let's keep our children at home, as we have been requested by our government. So apart from health-related impact, there is also a child development impact, we know. This means the children's opportunities for development and for early learning are now reduced. But the good news is that the quality and impactful learning and development can still happen at home and at a low cost under these circumstances. So parents and caregivers are now even more encouraged to engage and stimulate the children. So beside ensuring that the children's nutrition, health and safety are taken care of, parents and caregivers also need to stimulate early learning and to help their children to grow and develop at home.
Okay.
So here I would like to underline and tell parents and caregivers that they will not be alone in these additional efforts during COVID-19 times. The Ministry of Gender Equality, Poverty Eradication, and Social Welfare, together with our development partners, in this case, European Union and UNICEF, and the media, the civil society, the private sector, we will support and provide guidance to parents and caregivers on how to ensure that children, while at home, are being properly stimulated and developing all the necessary skills that they will need to thrive at school and later in life.
Okay, thank you very much. Just maybe on a follow-up question. We now understand the impact, COVID-19 has on our children, especially those ones at their toddlerhood level. I wanted to understand, we understand that they are now home, they have moved from the community kindergarten or any other daycare center where they were attending away from their home. They are back from home now. Maybe what you can add there is that how does then this has impacted the parents who happens to be the caregivers and who happens to be one of the role player in actually taking care of them now at home where they are?
Okay. I know that education starts at home. That we all know that education and the bringing up start at the home. So it is not a new thing that parents are dealing with their children's education or their children's development. This time around is just to say that they are full-time at home, but like I said, the ministry is working together to ensure that home-based ECD is encouraged and is supported. As a ministry, we also have decentralized staff members in the regions whom we have delegated to the regional council as part of decentralizations, but they are responsible for ECD service delivery. Now, while they are observing the lockdown measures, they will also be supporting the ECD centers and the educators who will in turn support the parents and caregivers with some examples, suggestions, and activities that they can do at home and with their children, so that the necessary, the cognitive, the emotional, the social and physical skills of the children are involved. I'm sure you would ask, how would they do that? Yeah. So as a ministry, we have different ways and channels to share this information with the ECD centers owners, parents, and caregivers. So as part of our national ECD campaign, which we call Right Start, which was launched last year in September, we have the following channels. We have our ministry website, and we also have the website of the campaign itself, the Right Start website. I'm sure you will just Google www.rightstart.com.na. We also have the social media, different social media, but also for those who don't have access to internet and TVs, and we will have call-in radio programs. So we will use all these platforms so that we share the necessary information, the activities that children should do with their parents, and parents should do with the children at home. And those are the avenues that we have. At the meantime, also maybe let me make it clear here to say that we support educators or teachers of kindergarten as a ministry, those that meet the criteria, with a little subsidy to be able to continue the education of children at an early stage. Just to assure that those that are on subsidy, the ministry will still continue to provide that subsidy through the regional council. Remember, the function has been decentralized. We make the payment to the regional councils, and then the regional council make the payment of the subsidy to the educators that are on subsidy. and we hope that they are not going to participate in the emergency income grant because they are already receiving this subsidy from the government.
Okay. Thank you very much, Ms. Mbombo. Just to take from your question, it's that the ministry is really an active player during this time of the pandemic. Ms. Godinho, we are speaking about the home-based early childhood development program. What is this program all about? Can you please talk us through that?
Good morning, and thank you for the opportunity to be here today having this discussion on the impact of COVID-19 on early childhood development. Before I answer your question, I would just like to maybe compliment in terms of the impact that the virus is having on our young children and also on their parents. So I think like all virus and all new situations, it creates fear. I mean, there's a fear about what is unknown, and of course people are concerned about their health and the health of their loved ones. There's also, in view of the regulations in place, the lockdowns, so there's a restriction on our freedom of movement, and that creates stress, some anxiety, also insecurities, and we as adults, we all feel that, but children and young children especially, they also feel that. Even if they don't understand exactly what's happening, they will pick up, so they will feel their parents' anxiety and stress. So I think that is an important impact, because we as adults, we have mechanisms to cope with this new situation and with this fear, but the young children, they still don't have those emotional mechanisms to cope with that. So I think it's quite important that we help our children to go through this period, and I think parents are in the front run to do that. And of course, as Ms. Marta already mentioned, there's a whole support system and mechanism behind parents, with the government, their services, the media partners, civil society, and the media. But I think the opportunity, just to finalize this first thought, the opportunity here is, if we do help our children to overcome now this period, we will be helping them building resilience. So in their lives, they will be stronger to face this kind of situation where there's stress and anxiety. And I think there's also an opportunity, because now children are spending more time at home, to build and to have quality time at home, and to have this new creativity ideas, how to spend that time. And just to link then with your question, the idea of a ECD home-based program is that we give that support and that guidance to parents on what to do now that children are at home, to keep their development, the normal development of a child, ongoing, and also to get them prepared later on to enter school, and then also for their lifelong learning and well-being in life. So as I was mentioning, the emotional support is quite important. So part of that program is to give tools to parents. How can they do that? How can they speak with children about the virus in the language and using examples that children can actually understand? And also always to try not to be too serious and too negative, but also to try to say that things will be okay. So there's a positive and hopeful engagement with the children, because that will help them to overcome this period. Another idea is, of course, how can parents also engage their children in activities, in playful activities, because as you all know, children learn best through play. So it's quite important that they play. And normally they would do it at home, they would do it at a kindergarten or at a pre-primary school. Now they have to do it all the time at home. So, and there's different ways of children playing. They can play on their own, of course, as we know, but it's also important that parents now encourage them to do other types of activities and playing with them, by just using, and that Ms. Marta mentioned, it doesn't require people to buy toys or to buy activities. You can just use whatever is around the house, like simple card box or simple bottles or pots, because the idea is to keep them engaged. So this is also part of the program, is to provide this guidance, these examples to parents on how can they make children play and keep learning at home. There's also information, of course, about the virus, and there will be a component on the program, because I think it's also very important to keep the nutrition levels of children ongoing. It means that even if it's a crisis, even if sometimes the income of households is reduced, we need to make sure children are well fed. Because as we know, in this period of early childhood development, it's very important for brain development, not just for their physical health, but their brain development and their skills. So keeping that nutrition levels is very important. So the program may also have this food security component, where we will provide a sort of food package or a food voucher, and then families can make sure that the nutrition levels, that they have food at home for the children. So this is the main activities under that program.
Okay, thank you very much. You mentioned about the aspect of stress, emotions, the anxiety that is actually created because of the period that we are living right now. Should parents find themselves in this situation where they are stressed, where there is emotion all over the place, what kind of support should they seek for?
Yeah. There's different ways that parents can do that. I think one of the first things is they need to also not be too demanding with themselves. I mean, these are not normal circumstances. So we cannot expect parents that some of them are now working from home, some of them have even lost their jobs. So they already are going through that stress. And now they also have the children at home that they need to engage, make sure they're well fed, they're safe, and they're still learning and developing. So I think parents also need to take care of themselves, and ways to deal with there's different ways to do that. I think one important aspect is to look for the right information. So the more parents have access to the right information about the virus, how it can be contracted, what can they do, that gives you some sort of reassurance, security, that at least you know what you can do within your control, and also to protect your children. It's also one of the advice we also give, it's also parents need to find maybe new routines. It's a new time. So maybe find new routines at home, a time where people are eating, a time where people are playing, a time where people are just having conversations about the virus and what to do about it. Also introduce a bit of relaxing and fun times. Okay. There's people that do games at home with their parents and their children and their siblings. So this is a way to deal with this stress and this insecurity. And I think at the end of the day, people also need to be very kind to each other and not be too demanding or too, otherwise you'll become exhausted, and then it's very difficult to go about it.
Well, thank you very much. Ms. Mbombo, during this year, we had our young ones that were actually in preschool, and they were being prepared for the first grade next year. What will happen now to these young ones should the pandemic persist?
Okay, thank you very much. Just to complement what Sonia have said, these are not normal times. Parents are also afraid, parents are overwhelmed. We also we have social workers on the ground in each region. We have divided them up in clusters so that they can also offer psychosocial support to our communities, which include parents and also to our children. Should the parents find themselves really overwhelmed in each region, we have circulated the number. Last time I was here on the platform, I have circulated the numbers of our social workers in each region. Some are in up to the constituency level, so that really they have somebody to talk to through these things and to get some psychosocial support. During this time also, you may come across also that children are being abused or psychologically or sexually or emotionally. We also have circulated the toll-free numbers of Lifeline Childline. We have 116 for Childline and 106 for gender-based violence. Those are also services that they can get counseling or they can get referred to the necessary service providers. To come to your question, John, like I said, the services we are rendering, it's covering the age group of 0 to 4. Yes. There is no pass or fail. There is development stage. So children will still be able to move forward to a pre-primary school, which is the age 5 turning 6.
Yes.
Yes, and we are working very closely with the Ministry of Basic Education, Arts and Culture to harmonize these areas as to how do children move forward from the 0 to 4 to the pre-primary, and so that there is a clear, a good progression from 0 to 4, 5 to 6, 6 up to 8. So really, there is no fail or pass. There is development that we are encouraging, that it should not stop due to coronavirus. We should still be able to develop our children. If you look at 380,000 plus children, we cannot afford to lose that opportunity that we have, even it is in the middle of the COVID-19.
Yes.
Yes.
Okay. All right, thank you very much. I'd just like to actually inform our viewers and the public that our calling line is open. We can call in. The number is displayed on the left bottom of our screen, so just dial that number and then we can have you in here just to, if you have any question to our panelists. Maybe the other question that I wanted to look at is the safety of our children. Our children in any crisis are actually the vulnerable community. What actually is expected of our parents, Ms. Mbombo, to ensure the safety of our children during this time?
Okay, I think I will give that one to Sonia to deal with for now.
Ms. Godinho, do you want to come in and help?
Yeah. So I think I've already mentioned some of the aspects which are very important for parents now to make sure children are safe. I think what you said, they're indeed the most vulnerable members of our communities, and I think it's very important to focus on them and to see what are their needs right now and how can parents do that. As I mentioned, I think it's important to lower our expectations and also not to be too demanding with parents. I think the number one aspect again is asking parents to talk about the virus with their children, to explain them how we can have these precaution measures, the hand washing, explain to them why they cannot now go to school or to kindergartens, why they cannot see their friends, and also to encourage them to find other ways to be active and engaged at home. So I think some of the ideas that we will be sharing in this home ECD program is to give parents those ideas. For instance, it's important also to keep the physical aspect of children active. So they need to develop their motor skills. So it's also important, if you do come to the streets, that children are supervised, that they're not just playing around alone, because it will be more difficult for them to follow those precautions. So they need to have a parent or an adult supervising them what they're doing in the streets. And I think it's also quite important that parents give the example. So if we need to follow these measures of hand washing, of keeping the distance when you're sneezing or coughing, to use your elbow. So I think parents also need to be very consistent in complying to those rules, because children will then understand that's also what they need to do. And they will tend to copy those examples of parents, and that's also a way that we are making sure they're more protected, because in a very easy way they will be following those measures, seeing that parents are doing that. So copying those positive behaviors is also quite important. And like I said, I think it's so important that parents also are not misinformed.
Okay.
You know, there's a lot of fake news, there's a lot of suggestions on how to address the virus, and parents may be tempted to try that with their children. So I think it's quite important to make sure that information is the official one, is coming from accurate sources, so then they are sure they're doing the best they can for their children.
Thank you very much, Ms. Godinho. Caller, can you welcome the caller in? Caller, good morning.
Good morning.
Yes.
I'm Benjamin calling from Lizard.
Yes.
I just want to find out, most of our kids that are in early childhood development are going to schools where they are closed or it's rounded off like it's small. It's not having a lot of breathing space, especially the kindergarten and stuff like that. So what the measurements that us parents have to take for our kids to follow the rules and regulations? And most of the kindergartens are having 50 to 100 kids in one building. So what provisions will be taken by the teachers and the government to assist them in that matter?
Okay. Ms. Mbombo, did you get the question?
Yes, I think I get it. I think, thank you, caller, for the question. I'm not sure whether the caller was listening at the beginning when we say that as a ministry we have issued a press release that all kindergarten, all creches, all daycare should remain closed until further notice. And this is in compliance with the regulation that was issued, that we should stay home, we should stay safe. We should keep the children at home, please. They should not go to kindergarten. If you have come across a kindergarten that is operating, whether is it with 10 children, please inform us as a ministry. We are not going to allow the kindergartens to open for now until further notice. Parents, let's keep the children out of the street. Let's keep our children at home, and so that they are safe, so that we save lives.
Thank you very much. It's now, we also have opened the floor for any question from our media practitioner at the center today. Any question? Yes, ma'am. Do come to the podium and pose your question.
Good morning. My name is Esther Kamati from the Namibian Sun newspaper. My question is to the ED, and it's mainly around the issue of food security. I would like to know, is the food bank project still an existing and operational project, and what is the ministry doing to secure, to make sure that the children especially have food security? Thank you.
Thank you very much. Another question from the media practitioner on the floor? No question?
Okay. Hello?
No question?
Yeah, I have a question.
Oh, all right. Yes,
Yeah.
caller, please ask your question.
My question is, I have a kindergarten which is, I have it for 15 years. And I was still operating where all this problem happened. Now, I want to know, I heard about that the kindergartens were getting grants from the government. What will happen with us? We never get a grant from the government. How the government will support us? That is what I want to ask. Maybe the question was already said, but listen, I am coming in the middle of the program. Now I just want to ask that question.
Caller, may I kindly ask you to repeat your question?
I just said I have a kindergarten which I was running for 15 years. And now all this problem, we have to close down the kindergarten. I understand the reason why we have to close down. How we have to be helped by government, because we don't get a grant from the government. We are running the kindergartens by our own, with the money what we are getting for the parents. Now they have to be closed down, and we have to stop all the things. What will happen with us? We don't get a grant from the government. That is what I want to ask.
Okay, Ms. Mbombo, maybe just to attend to the first question there from the media practitioner on the food bank project. Is it still running?
Okay, thank you very much. Let me start with the last question.
Okay, all right, ma'am.
Yes. Thank you, caller, for asking this question. I was actually expecting this question because our initial press release that we issued, I think we have had said that kindergarten owners should submit proposals to the ministry for subsidy, which we have then later on clarified to say the subsidy, the modalities for subsidies to the employers to be able to pay salaries for their employees is still being worked out by the Ministry of Finance. We know that that space of subsidies and all the stimulus is the space of the Ministry of Finance.
Okay.
So we consulted with them, they are busy with that, and that is the category where our ECD owners are falling, because most of them and their employees, they may not qualify for the emergency income grant. So we are just asking for the communities to be patient while our government is working out modalities on how that is going to happen. And the Ministry of Finance will announce that, as they have announced the emergency income grant. I know we should appreciate also that some of our kindergarten employees were getting little money from the contribution of the communities, and they also have benefited under the 750 grant that most of our household people have got. So we really appreciate our government for that boost to our communities. So dear ECD owner, please just be patient. The Ministry of Finance will announce, together with other stakeholders, they will announce what are the modalities for this aspect of support.
Okay, thank you. Before we answer the second question, can we take the Esmeralda on the line? Esmeralda? Hello?
Hello?
Yes.
How are you, sir?
Yes, how are you?
Hello?
Yes, hello?
How are you, sir?
Yes, we can hear you.
I want to pose my question.
Yes, may you please pose your question?
There is somebody who taught for 20 years deep in the village, where she's helping her kids, but she don't get anything from. She normally gets a support from the parents in the village, like the payment for their kids. Now, I have a question here about what is the Miss Malcolm Mbombo is. What can she say on this?
Kola, may I ask you to repeat your question again?
Miss Mbombo, what is she saying regards to the teachers who are teaching, who own their kindergarten deep in the village, where she gets her support, their support from parents who pay for their children's fees, the school fees.
Ms. Mbombo, did you get the question?
No, they don't.
Say, can you kindly repeat your question? What is your question?
My question is, Ms. Mbombo, what is she saying regards to those kindergarten owners deep in the village who support their family from the money they get from the parents who pay for their children?
Okay. Ms. Mbombo,
the kindergartens are not registered, they don't get any support that she stated there.
Okay, Ms. Mbombo, the question is still on the issue of actually the people that owns kindergarten, but these parents actually survive on that income when parents pay for their kids to attend kindergarten. Yes. So it's still the same issue that they're asking for.
Thank you, Kola. I think it's the same question. I think we all know the emergency income grant for the household. It caters for the household, for people who are unemployed, for people who lost their employment, and those, I think it has a cut-off point to say that you should be not earn more than this. Yeah. So for those employees of the kindergarten who are within the brackets of the of the emergency grant, my understanding is they have that opportunity to claim from the emergency grant. But then you have the ECD owner who is also having employees who are earning more than that, and they are not able to afford to pay them a salary that they were earning before. So that is a category that I was explaining that the Ministry of Finance is busy to work out the modalities of the support to the employers. Yes, that's what I was explaining.
Briefly, Ms. Mbombo, again, please may we attend to the question of the food bank project.
Okay, the food bank project, my understanding is it's a new area to our ministry. As you see that I'm more on gender equality and child welfare, but the understanding is the food bank is still in operations. The schedule, there is still they are still following the schedule of distributing food as it has been. Last week, I think you have witnessed that our minister was on media observing the distribution of food at Commersdal. We also have contributed food parcels and food products to the homeless people that are accommodated at Commersdal Stadium and at the youth center, and also in other regions. So the food bank, it is still operational, and it is also giving support in terms of emergency food that is required, obviously together with other players like the drought relief fund, and also private sector and individuals.
Okay, yes. Thank you very much. Caller, good morning. Good morning. Good morning, caller. John, good morning. Okay, we lost our caller there. It seems like we have lost our caller there. Yes, hello. It seems like we have, yes, caller, good morning. Okay. Ms. Godinho, maybe just with your final words, remark, can you please just talk us through your final remark as far as early childhood development is concerned, looking at how it is impacted by the current situation right now?
Thank you. Well, I would say that, and I like to commend here the ministry, because since the beginning of this crisis, I think they have been very proactive and taking into account the situation of the young children and their parents in this period of early childhood development. And I think in terms of the way forward, ourselves, the European Union, together with UNICEF and other partners, we have been working in these areas, and we will continue working in these areas, because as you know, there are short-term impacts, but there are also long-term impacts. So we will try now to focus on supporting parents who are physically alone in the house, but they're not alone, because they will have the systems to support them. And then of course later on to make sure there's a transition from the at-home to back to the early childhood development, and continue working on the quality and improving access to kindergarten and to early learning opportunities for children. And I would just like to say that, of course, besides this emergency program that the European Union is now supporting the ministry to set up, the European Union and my colleagues and myself here in Namibia, we are also working very closely with the government on a package, a bigger package, to support Namibia in fighting this virus. But that package will be very soon announced by our ambassador, Ms. Senika Antila, and I hope we can definitely continue supporting the country right now and also in the long-term future. Thank you.
Thank you. Ms. Mbombo, just some few concluding remarks on the way forward.
Thank you, John, and thank you. We appreciate this opportunity that
just having some, okay. Yes, Ms. Mbombo, you can continue.
Thank you. We appreciate this opportunity as a ministry with our stakeholders to come to the COVID Information Center to really share with the nation how COVID is impacting on our services and what other alternatives are we really trying to employ so that we deliver services. I just want to encourage the community to interact with us. This is not a once-off interaction. Please interact with us, leave your comment on our website or email us so that we also see and take into consideration your thoughts about how we should deliver services. A number of parents, a number of ECD centers have been doing so, and we are taking them into consideration. Let's just be rest assured that our government is still committed to the development of its children at an early stage, even in the middle of the pandemic. As per our Child Care and Protection Act number 3 of 2015, the ministry and all stakeholders are required to always act in the best interest of the child. And that child, in our term, is the child under the age of 18, but in this case, we are talking about 0 to school-going age. So we should really act in the best interest of the child. So the reason why we say this kindergarten and ECD should remain closed is because we are acting in the best interest of the child, and we are taking care and protect our children to make sure they stay home, that we prepare nutritional food, as we have seen, nutritional meals, with whatever our government is providing us, with whatever our Samaritans are providing us. We teach them to follow the rules. They wash their hands with their small hands, with their little hands with soap. They cover their mouth when they are sneezing or coughing. Of course, it will be difficult to say keep a distance. When we go out for a walk in pairs of 3, not the whole family, and should we observe that they have fever or they have dry cough and all the signs that are being spoken about, we should please call that toll-free number of 0800 100 100 so that we are helped while it is early. So in case of abuse within the family, or if communities have noticed in the neighborhood there is abuse of children and also of adults, please call Lifeline Childline toll-free number 116 or GBV helpline 106 for assistance, or call on our social workers, a nearest social worker or a nearest a church leader or a nearest community leader to assist you. I just want to really ask our fellow Namibians, we are all in this. Let's be peaceful, as the pastor have said today. Let's be hopeful. There is hope at the end of the tunnel. It is not all doom. I think my own belief is God is greater than coronavirus pandemic. Thank you.
Thank you very much. Thank you very much to all our panelists for being here with us. This is all we have today, is we really unpacked the impact of COVID-19 on early childhood development. The good thing is that the Ministry of Gender Equality and Poverty Eradication and Social Welfare, together with their partners, they are really actually playing a major role to ensure that the learning, developing, and actually growing of our children continue during this difficult time. That's all we have today. I would like to thank you, and please to continue engaging us on our an email should you have any inquiry. That's covid.nam@mic.com, or please dial 0800 100 should you have any queries related to COVID-19 in Namibia. Thank you very much.
Thank you. Education starts at home. That we all know, that education and the bringing up start at home. So it is not a new thing that parents are dealing with their children's education or their children's development. This time around is just to say that they are full-time at home, but like I said, the ministry is working together to ensure that home-based ECD is encouraged and is supported. As a ministry, we also have decentralized staff members in the regions whom we have delegated to the regional council as part of decentralization, but they are responsible for ECD service delivery. Now, while they are observing the lockdown measures, they will also be supporting the ECD centers and the educators, who will in turn support the parents and caregivers with some examples, suggestions, and activities that they can do at home and with their children, so that the necessary, the cognitive, the emotional, the social and physical skills of the children are involved. I'm sure you would ask, how would they do that?
Yeah.
So as a ministry, we have different ways and channels to share this information with the ECD centers owners, parents, and caregivers. So as part of our national ECD campaign, which we call Right Start, which was launched last year in September, we have the following channels. We have our ministry website, and we also have the website of the campaign itself, the Right Start website. I'm sure you will just Google www.rightstart.com.na. We also have the social media, different social media, but also for those who don't have access to internet and TVs, and we will have call-in radio programs. So we will use all these platforms so that we share the necessary information, the activities that children should do with their parents, parents should do with their children at home. And those are the avenues that we have. At the meantime, also maybe let me make it clear here to say that we support educators or teachers of kindergarten as a ministry, those that meet the criteria, with a little subsidy to be able to continue the education of children at an early stage. Just to assure that those that are on subsidy, the ministry will still continue to provide that subsidy through the regional council. You know, remember, the function has been decentralized. We make the payment to the regional councils, and then the regional council make the payment of the subsidy to the educators that are on subsidy. And we hope that they are not going to participate in the emergency income grant because they are already receiving this subsidy from the government.
Sorry?
Thank
All right, so that was all the time we had here at the COVID-19 Communications Center at the Commerce Regional Council. We had the discussion around how the COVID-19 pandemic has impacted early childhood development, and we heard from the executive director of the executive director. The Deputy Executive Director, of the Ministry of Gender, Poverty and Social Welfare, where she informed us that no early childhood development centers are allowed to be operational during this time, and if one identifies such an area that is still operating, they should inform the ministry immediately, even if it is less than 10 individuals at the center at that moment. She also ensured us that the ministry is working actively to ensure that parents, of course, assist their children in their early development stages with things such as call-in radio programs that are an intervention and toll-free numbers that they can dial. She also reassured that the ministry is surely working towards the issue of abuse in the households, and advised parents and anybody in abusive situations to contact the toll-free numbers. They've also made social workers available on toll-free numbers that individuals can speak to. So of course, join us again for the next update and keep yourself posted on the social media platforms being Namibian Sun, Republican, Allgemeine Zeitung, the community newspapers, Windhoek Express, and Irongo, and have yourself a lovely Sunday.